Hello, everyone. Welcome to Mental Health Festival 2025. For those just joining us, my name is Vanessa, and I'm the Deputy Lead of Care Accounts here at Intellect, where I support leading mental health service delivery across regions, ensuring high-quality care and sustainable clinical outcomes. And I'm thrilled to be your host and moderator for this session. We're picking up from the previous session where our leadership team shared an inspiring message on the importance of building sustainable ecosystems of care. But with this session, beyond the buzzwords, what real mental health impact looks like, we'll be talking about a topic that's more important than ever, which is creating a thriving global workforce. And allow me to preface today's session by emphasizing this. There's a tremendous opportunity in front of us, and it's this. If we focus on employee well-being, we can unleash immense potential within our people and organizations. Today, we're privileged to hear from two incredible voices, one bringing the employer's perspective on how mental health support is being scaled in the US, and the other sharing firsthand experience as a well-being advocate who's helped organizations navigate real challenges from the inside. So let's bring them on. Our first panelist is Kelsey Quick, and a strategy and operations leader. Kelsey is a consultant for care delivery organizations as they design, scale, and refine their provider network strategies. And our second panelist is Stuart Mace, a workplace health and well-being advocate with previous successful managerial careers in health and fitness, as well as recruitment. And to help frame our conversation, we'd love to hear from you, from the audience, with two quick questions. So if you could please use your tablet or laptop to scan the QR code that's going to be shown. You have the option to enter your name or remain anonymous. But if you could just take a moment to do that, and we'll gather those as they come in. Okay, it looks like we have some responses there. All right, this will take just a few seconds more. Looks like we've got the majority coming from Asia Pacific, facing the biggest challenges, and then across all regions. There's a tie there. Okay. Europe, North America, definitely. All right. Looks like we're hitting a tie on both Asia Pacific and across all regions. Sounds about right. Okay. Also to our audience, by the way, please feel free to add your questions to the for the panel into the Q&A box at any time. So it looks like we've reviewed the most significant challenges that our audience is facing. So for our number one barrier to global well-being success, looks like we've got cultural stigma and local nuance, followed right behind that with managing vendors and program logistics. And then it looks like we were still tied on the Asia Pacific and across all regions on the other question. So to kick things off, Kelsey and Stuart, I'll start with one of you just a minute, but could each of you share which of these challenges from these two questions hits closest to home for your work and tell us about why?
Would you like to go first, Kelsey?
No, you go first, Stuart.
Okay, thanks. Yeah, they're surprising. That the last two, the leadership buy-in and what have you, I thought would play a part. But it's interesting to see how culture and stigma, bearing in mind where most of the audience are responsible, should we say, for the mental health and workplace health and well-being are at the moment. It sort of shows there's some, I think, some differences there globally, because I've feel sitting in Europe that a big issue for us in this part of the world is getting buy-in and getting budget for the initiatives to push forward. So yeah, it's interesting to see those barriers are affected culturally and globally.
Absolutely.
Yeah. I think my thoughts on it are similar, and I sit here in North America. I think when I was at Spring and we were trying to go global, like understanding the cultural nuances and the regulatory framework of going global was really complicated. But if you take 10 steps back, if we didn't have the budget from these companies beforehand, then you had no opportunity to go global. So that was always sort of the problem that we were most concerned with wrapping our head around. And I'd be remiss not to connect that to ROI. So if you're selling into employers, they of course care about the well-being, or hopefully they care about the well-being of their employees. But I think being able to connect mental well-being and perhaps some of the outcome related mental health metrics that people use, such as the PHQ-9, measuring depression, or the GAD-7, measuring anxiety, like connecting those things of your employees to other healthcare costs, hopefully going down, or absenteeism, hopefully going down, or productivity going up, or even the bottom line improving. That was complicated. Even getting access to the data was complicated.
Yeah.
So I'd say we spent a lot of time thinking about ROI and how to use that to gain buy-in from leaders.
Yeah.
Great.
If you don't mind me asking, Vanessa, Kelsey, I wonder if you mentioned a point there, which was regulatory and maybe sometimes legal aspects of it, and I wonder if the results are reflective of what's legal in some countries or parts of the world and what's not, with regards to how what are the drivers for looking at mental health and well-being within organizations.
Yeah. Go ahead, Vanessa.
No, I was going to say that is an interesting question of perspective. Those insights, it's clear that there's some hurdles, and to echo you, Kelsey, as well, that gathering that data right on the insights and connecting them in terms of organizational well-being and mental health, and then putting that into play is 100% a challenge. I think, Stuart, that question is absolutely valuable. I think we might be able to reflect on that and maybe get an answer to that and bring that up a little bit towards the Q&A session.
Sure.
That's absolutely like a very valuable insight. Thank you both. And it's very clear also that our audience faces significant hurdles, right? And your feedback really from both of you illuminates those primary challenges when it comes to supporting mental health and achieving that global well-being, if we're trying to do that right on a global scale. Kind of also leads us into our first topic, which is the importance of moving beyond a universal kind of one-size-fits-all strategy. So Kelsey, kind of bumping this back over to you. We often hear about a well-being paradox, right? Big investments in mental health, but the burnout is still high. From your experience perspective, building and scaling clinician networks, that is in the US, where do you see the biggest disconnect between program design and the lived experience of employees?
Yeah, this is such a good question. I think a lot about it personally as a leader, because when my team is burnt out, I'm worried about it. And of course, I work in the mental health space to help other employers think about that. I think, like, outside of the program logistics, we can't talk about mental stress and burnout without talking about the broader environment that an employee is in. So I think beyond work, there's so much. There's the political environment, there's the social environment, there's what's happening with technology, there's someone's like individual financial situation. And so I think this element of like social determinants of health of the user or of the employee who you're reaching with those mental health benefits is a really important aspect. I think like throwing therapy at someone who is working minimum wage kind of misses on a really big aspect of their overall well-being and mental health. So at a lot of the companies that I've worked at over the last 5 years, yeah, we've spent time on that. How do we work with unique employers to take our program and add to it in a way that makes sense for the archetype of their types of employees. So I'll give one example. Working with Delta Airlines, where they have lots of people who are on site and working daily, like putting therapists and even beyond that EAP support, where you might get financial coverage or legal coverage in the airports or in the like physical space of the employer was an important part of us trying to see the whole well-being of the person and the inability to like get to therapy or open up a computer and see a therapist. But it's a complicated problem as an operator. That's a really complicated thing to solve for. And so it's not one size fits all, I agree. And I think, yeah, thinking about it in that way is just one angle.
Absolutely. Thanks, Kelsey. Yeah, it's very important to consider that perspective, or not the perspective, but the, like you mentioned, the environment that employees in, instead of just throwing that an option for therapy that may not be what's needed, right? It could be something completely different depending on the line of work and on the experiences they have on a daily basis. So super insightful. Thanks very much. And I think that also kind of segues kind of into like the human element behind it, right? So next question for Stuart, shifting a bit to address what's behind like kind of all of this data, right? Or just in this human perspective of it. We all know leaders love their dashboards and our ROI slides, but people aren't line items on a spreadsheet, right? So in your experience, how do you convince leaders to balance the metrics with human elements like trust and culture that can't be fully captured on a dashboard?
Yeah, sure. I think we need to look at similar to what Kelsey was saying there, the bigger picture here. And I think workplace health and wellbeing or mental health of employees is more than numbers and the ROI. If an organization is concentrating and focus on the ROI as their driver for initiatives, you're going to be really questioning if that's the right driver for it. I do think it's a byproduct, don't get me wrong, and I do think what we measure was important. But what I found has worked to sort of really engage leaders or line managers into this aspect as to why it's important that we do look at metrics and we do look at trends is really looking at going beyond that, as I said, and it's really when you start to look at what drives leaders and maybe some organizations, it's more of the aspect of the emotional aspect, emotional intelligence and that intellect. And what I find works when I've had let's say line managers moaning that they have to fill in a spreadsheet which has no use to them or they don't feel has any use to them is really I look at asking them how they want to be perceived in an organization, or what would they like their legacy to be. And you generally find that managers want to inspire others. It's about how they make each other feel. They want to allow their staff to develop, grow, and encourage them. So I really ask the leaders, what do they want to be remembered by? Because you generally find that will drive the right behaviors. And work is a determinant of our health and well-being, and therefore, if we're looking after our employees in the right way, that's going to have a ripple effect. So it's a bigger picture here. It's not just on work, it's on their families, it's on friends, it's on society. So I think there needs to be an element of looking at how we can talk to our line managers and our leaders about conscious leadership, about sustainability, and look at the bigger picture, and not just driving a number, not just driving a metric or a KPI, because we're likely to fail on that. You'll generally find that the ROI and the trust and the culture will win anyway if we're using workplace health and well-being as a strategic driver, and not just as an outcome to sort of to drive profit. So, you know, for me, it's really engaging with a line manager as to it's important, but what's their drive for them to really want to understand why they're looking to get, you know, the best out of their employees in the right way.
Yeah. Thank you much gratitude for sharing that perspective. It's super important. I think, you know, definitely something we can probably all relate to in terms of, it's very important that we need to capture this data, but, you know, when we're talking about leaving a legacy, right? What insights do we want to gain from that? And how do we want to share that, to really show not just the value, right? But how this is supporting, or maybe the model that we're using can be improved, right? So, that's a very great insight and appreciate that very much. And keeping in mind that humanistic approach kind of aligns me to my next question, which is for Kelsey, excuse me, Kelsey. Kelsey, let's talk about assumptions when it comes to expansion. So kind of keeping in mind, when you as employers expand mental health programs globally, from your perspective, what's the single biggest assumption you see employers making, such as care delivery and provider networks of program design, that really tend to cause a global blueprint to fall apart in practice?
Yeah, I think, and I mentioned this a little bit earlier, I think when we're looking at the global picture, like underestimating the regulatory maze and the cultural nuances that exist outside of the place where the solution was built is like a very dangerous assumption. And I've seen it firsthand. And so I think you can design a great global well-being program centrally, but if the language or the local norms, or even, and this was a really big one, the stigma around mental health isn't addressed, then utilization remains low, and uptake will remain low. And so I've seen programs succeed beautifully in certain regions of the world, and then, you know, we take what worked really well there and try to apply it somewhere else. And because we didn't translate with cultural context the makeup of that program, it failed. So I think that is probably, from a global perspective, the greatest, like, dangerous assumption, I would say.
Yeah, absolutely. Definitely. Thank you for sharing that. Yeah, those
And
are,
I will say, like, the work to go understand the cultural nuances is a lot of work. And so I spent hours, my team and I spent hours understanding, like, what are the differences in this country versus this country from the therapist themselves. So my role in most of the companies I've worked at has been the provider side, and that's a beautiful way. That's a beautiful way of getting insight into the cultural norms and nuances. Is ask them, say, what do you see with your patients, and what are the things that we might be missing because we're looking at it from a different culture.
yeah. Thanks, Kelsey. And can I just a quick follow up on that, if you can maybe summarize just kind of what were the findings, or what are the findings that you've seen when you're getting that perspective from therapists from different regions, or kind of what are maybe a couple of things, for example, that are really important to take into account from their perspective when it comes to those cultural norms and considerations?
Yeah. I think, like, the clinical assessments and people's comfort with putting, like, self-reported assessments of their mental health on paper. That wasn't always in the US. That was always where we started and said, okay, give us the data. Like, tell us how you're feeling on a scale of 1 to 10. When was the last time you felt like you didn't want to get out of bed? And in some regions, like, people are less comfortable putting that on paper. I think another thing is even the language you're using. So calling someone a patient versus a client versus a user. You know, some people don't use such, and this happens in the US too, the different nuances, but some people don't use such clinical terminology when talking about mental well-being. And so trying to, like, soften some of that language. Those are, like, 2 examples that come to mind.
Wonderful. Thank you. Very inspiring. All right. Looks like we have a question, but before I get to that, just one more here, maybe we can touch on real quick. Pivoting back a little bit to the people working behind the scenes to make this all happen, right? So going back to you, Stuart, a lot of times managers are being asked, right, to drive both that well-being and performance aspect of it, often without the right tools or support, or sometimes without the right tools or support. But from your perspective, what's the uncomfortable truth that we're asking of managers, and perhaps
Yeah.
radical shifts are needed to set them up for success?
Yeah, good phrase, uncomfortable truth. Yeah, on this, I think there's two things here. Is there's certainly an organization needs to look at taking responsibility for understanding what competencies are required of their managers. What are they, and what are they asking their managers to do? Because who would be a manager these days? I mean, really, when you look at it, and you know, they are really squeezed. So I do think organizations, if they're going to put people in managerial roles, they look at the competencies, they look at how they train, they look at what's needed for their employees, and look to provide those. And it's looking at providing those skill sets or resources, so you know, they're protecting them from harm. We know what's going on within organizations, but yet we continue to allow managers to, you know, be squeezed from, you know, from senior leaders and their employees, and to a degree managers almost expected to be everything and anything to their employees. So we're kind of setting them up to fail. So I do think there needs to be an element of an organization taking responsibility. But on the other side, I'd also think line managers have to also take responsibility for what they've been asked to do. And there does need to be, I won't say resistance, but there certainly needs to be an element of pushback as to, if you're not able to do what's been asked of you, you're going to set yourself up for failure. You're not setting those boundaries in place. You're making it hard on yourself. So it's making those hard decisions now for future wins. And it's saying back to the organization, you're asking me to do things that I physically or mentally can't really get to. So it's creating that environment where, you know, you can say that to managing up the food chain. Everyone has a boss. Every manager has a boss. Even the CEO has a boss somewhere along the line. Normally it's shareholders. So it's setting that expectation. I think it's being open and honest about when is work not good for them, and hold everybody accountable up the food, hold everyone up the food chain accountable, and be true, you know, to be real and be true to yourself with regards to how you are showing up for work each day and how it's making you feel. You got to sort of create that environment up and down the food chain, I'd say.
Wonderful. Yeah, that's fascinating insight, Stuart. And I believe really a lot of our audience is going to connect with that. It kind of just really kind of encompasses, right, like what's going on the manager side and how to best support them. Thank you for that very much.
Can I just jump in?
Absolutely.
I completely agree. And I think we did, at some of the companies that I've worked with, we did manager training as understand how to support the well-being of your employees. But also, if you don't walk the walk, then like you're going to run into problems. And so teaching managers who are, you know, everybody has one, but who are setting an example and setting the tone of burnout or stress or workplace issues is so important. And I think like ties into hopefully any well-being program.
Absolutely. Yeah, great point, Kelsey. I mean, we really can't, or, you know, best practice, I think, especially as a licensed therapist myself, is we need to make sure we're, of course, taking care of ourselves, right? And then being able to support those that we need to support with and work with us on a day-to-day basis, especially if we're talking about well-being and promoting that. So thank you both for that feedback. Amazing. I will go with one more question and leave this open to either or, because I do want to leave some room for Q&A from our audience, which I know we have a couple of questions. But I think what we can start with is inside organizations, there's really no shortage of surveys, dashboards, and well-being data. But I think the real test here is whether employees actually see change. So from either of your perspectives, how do you make sure that employee feedback and well-being data actually leads to tangible change that employees can see and trust?
Yeah, I don't mind jumping in on that one quickly, Kelsey, seeing as it's something I've looked at within organizations. I think first and foremost, there's no point in not acknowledging what's going on in an organization and burying your head in the sand as to whether or not it's happening. It's happening. So I do think there needs to be that element of actually understanding that, and let's look at it, and let's let's take accountability and responsibility for that. Clearly, we've got to look at clear feedback loops, create the environment and those opportunities for the clear feedback loops. But again, I'm going to come back to that element of being accountable and being responsible. Don't just look at the easy wins, look at the long term, look at the hard things to deal with. And what I generally will find is that the hard things to deal with is how do we protect people within work, how are we ensuring that we're not causing them harm? Because the wellbeing things, initiatives can help, but I think we really need to look at what are the root causes of what's causing people not to be at their best in work, and look at dealing with those. And generally, I find if you're open and honest about that, you'll start to build some trust and demonstrate how you made the changes.
Awesome.
Yeah, I would agree. I would agree with everything. I think dashboards should be used as, and this is the way that I've always used them, even in my own operations work, like they're a clue to what is worth going and digging a little bit deeper in. So the data can tell you something and hopefully lead you down a direction, but then without the like deep conversation or session as a team or session as leaders, like, and really understanding what do these numbers mean or what do these survey responses mean, you're not doing the numbers justice if you're not digging a layer deeper to understand the why and the details behind it.
Absolutely.
Well, yeah, very powerful framework, Stuart, and thank you both, Kelsey as well, for those responses and sharing. Today we've explored several key themes in a very short amount of time. The well-being paradox, the human element really behind those numbers, and then making kind of a dangerous assumption right, especially in talking about the manager squeeze, like we mentioned, and then the importance of really looking beyond that dashboard data, right, to the humanistic sides of things. So thank you so much to our panelists for an insightful discussion on what real mental health impact looks like. Before we jump into Q&A, do note that we have embedded a download link for a practical guide for any HR leaders. 10 ingredients you're missing in your wellness program. It can be found in your resource section. And the team has also shared the link in the chat. So going on, we have a few minutes left for Q&A. I see a couple of questions from our audience, so let's turn to it. But feel free to keep them coming in the chat box. If we can't get to them, we'll try our best to respond in another way. So let's see what we have here. First question is, what's one blind spot global HR leaders often underestimate when trying to roll out the same mental health program across countries, and how do we avoid that?
I'll jump in, Kelsey.
I wouldn't add anything that I said earlier. I think it's just like that the exact same language, that the exact same type of good in terms of what you're looking for in a therapist applies in the same way. I think it's worth understanding, how do our questions for interviews of providers need to change? How do our questions of clinical assessments need to change? What are the things that we haven't thought about? Because we do it this way over here that like are worth double clicking on before we go global.
My response to that quickly would be, get the evidence and the data to support what you need to be looking at. You've got to consult with the workforce. You can't just blindly roll out a mental health initiative without understanding why you're doing it. And you need the buy-in from your workforce to do that. So we saw at the very, very beginning, there's nuances culturally. So therefore, you've got to drill down on that. You've got to get that qualitative and quantitative data to understand why you're rolling out a mental health program. And HR needs to speak to everybody in the organization, if it's HR who are looking to roll this out, and get a lot of collaboration to understand what's the evidence to suggest you should be doing what you're going to do.
Yeah, thank you both. Thank you, Kelsey and Stuart, for such thoughtful responses. And thank you to our audience as well. Unfortunately, that is all the time we have for today. If you have time, please join us for our next session, Going the Distance, Scaling Global Benefits with Local Precision, where wellbeing experts will be exploring strategies that address local needs at a global scale. So to join us, you can do so by simply returning to the lobby page and clicking Join Now button beside the session title. We've dropped the lobby page link in the chat as well. Thank you so much, everyone, for being a part of this important conversation, and hope to see you in our next session. Hope everyone has an amazing day and rest of your week.
Thank you.
Thank you. Thanks, Vanessa. Thanks, Stuart.